Costochondritis can mimic chest pain, rib pain. That's what costochondritis is. Do you see how this over here, this side, this clavicle is higher than this thumb? Hi everyone. All right, if you have chest pain, rib pain, you need to watch this, okay? First, you may be thinking, God, I've looked through all these videos on YouTube and I think I have costochondritis. Maybe not, okay? So costochondritis can mimic chest pain, rib pain. That's what costochondritis is. So we're gonna show you Samantha here, who has a lot of, well, why don't you tell them?
So I've got a lot of tightness, pain coming from the muscles up here. It goes into my shoulder and even into my shoulder blade.
So she's got chest pain radiating up into the anterior shoulder, posterior shoulder pain. But, you know, and again, this is common symptomatology of costochondritis, but she does not have costochondritis. If she had costochondritis, most likely it would increase the pain when she took a deep breath in at the top of that breath, and she doesn't have that. And I also know because I've seen her before, and I got a little bit of a, I'm cheating a little bit because I've seen her before and I've already done an analysis on her, but we're gonna show you what's going on with her. And you can do this check on your own from the comfort of your own home right in front of the mirror, okay? Come on over here. So this is what you're gonna do. You're gonna stand in front of the mirror and you're gonna go like this. I have broken fingers here, so you're gonna go like this, okay? And see which one's higher. And I'm gonna show you on hers with my thumbs. You obviously can't do it with your own thumbs. It's kind of hard. You're gonna have to use your index finger when you do it in front of the mirror and make sure they're level. So we're gonna stand right here and we're gonna show you her clavicle. Does anybody see a problem with that? Do you see how this over here, this side, this clavicle is higher than this thumb? Okay, pretty significant. It doesn't look like a lot. It's only a couple millimeters, but that makes a big difference. Anything over 5 millimeters is a separation. So we're gonna have you bend your arms and you're gonna raise this side up as high as you can. Okay, and she's probably gonna be limited on this side. Yeah. And it's because this clavicle is high. So we need to fix that. Probably her pec muscle is affected, and that's why she's having that chest pain. And not to say that this can't cause costochondritis at some later point if you don't address it. It definitely can. And you don't want to go down that costochondritis road, okay? We see a lot of people in here for that, and we've done so many videos on costochondritis stretches, treatments, exercises, I mean a bunch. So make sure to check out the costochondritis playlist that we made, okay? But now we're gonna go ahead and fix her clavicle. So first I want to have you lay on your back. So I'm gonna go through and just do a couple of muscle tests here, and I'm gonna have you turn out like that. I'm gonna take this hand if you don't mind. Good. And I'm gonna pull out this way, I want you to resist, and then this way I want you to resist on both. 1, 2, 3, resist. That hurts, okay. Well, you heard that, and she was weak in that area, and 1, 2, 3, resist. Okay, and that hurt as well. Okay, and this side. So it was painful and weak, so obviously that was a test for the pec major and the clavicle. So she tested positive for both, and when we did it visually, we could see that her clavicle was out. That's a clear-cut obvious sign that she's got a subluxated clavicle. And that clavicle holds the shoulder to the axial skeleton. This is the only bone that connects the shoulder to the axial skeleton. So when this is out or higher up here, it's going to be lower on that end. That's why she was unable to lift, her right shoulder. Okay? So we're going to test the good shoulder, and 1, 2, 3, resist. Good. And 1, 2, 3, resist. Good. Any pain?
No.
Okay. So we're going to go ahead and just stretch the pec major. You can do this on your own. Again, I've done some videos on this. It's on my 3 favorite stretches for costochondritis, or my three best stretches for costochondritis. So you're going to raise your hand all the way and touch my leg. Yep. Yeah, it's going to be a little bit uncomfortable. This is called ART, active release technique. And again, you can do this at home. So stop for 1 second. So how would you do this at home? You grab the pec muscle and you pull down, and you raise your arm up. Drop it. Grab the pec muscle, pull down, and raise the arm up. Let go. Drop it. Grab the muscle, pull down, and raise the arm up again. That's it. You can do that on your own. Nice and easy. All right. Ready? Go ahead. Okay. It's already getting better, huh? This spot's still tender.
Can feel it releasing.
Yeah. And make sure you do that tissue pull towards the midline of your body. Okay, that's important. Now I want you to turn your thumb down and do that same thing.
Ooh.
Okay, now I want you to turn your thumb. Turn it out and do it. One more. Okay. Slide up. Okay, now I'm going to have you turn your face towards me. So we're just going to adjust that clavicle from superior to inferior and medial to lateral. And we're using a little drop table here to do that. And one last drop here on the clavicle, one last clavicle adjustment here. Okay, hands stand up here in front of the camera. Look at that. Still a little higher. So we're going to adjust that again. Go ahead and lay on your back. Okay, come on up. You see it's still out a little bit. It's better, but it's still higher on this side. So I am going to do another adjustment here. I'm going to have you lay on your side facing that way. Okay, but Unfortunately, you're not going to see from this angle, so we're going to have the camera guy switch to the other side here. Okay, so now we're going to just do a different type of clavicle adjustment here. Okay. And have you bring your head back. And just relax here. Okay. You okay there?
Mm-hmm.
Not too bad? Okay. Now I'm going to have you stand up right here. Okay, and face the camera. Much better there. Okay, now we're going to tape it down. We're going to show you how we tape down a unstable sternoclavicular joint, or a clavicle at the sternum. That's what the sternoclavicular joint means. So let's get into that and show you how we tape a shoulder. Okay folks, so I've taped a SC joint before, so we're going to show you how we tape a clavicle. And I guess you could do this on your own. It's a little hard though to do on your own, to be honest. Just certain parts of the body are a little bit difficult to get to, doing on our own. But let's go ahead, and I like round edges on the KT tape. Otherwise, if it's a straight corner, it gets caught on your clothes and it doesn't stay on as long. So we're just going to crease the middle here and just tear that. Okay, now what we're going to have you do is bring this arm back like that. Yep. And while this tape, for some people, if you have an allergic reaction, can be uncomfortable, we know that we've KT taped her in the past, and we know that she is fine with it and won't have any reactions. So we just lay that tape down. Watch your fingers. Ooh, and your shirt here. Okay. Okay. Now we just why don't you rub that tape with your hand just to get it to stick better. Yep.
Get the adhesive working.
Exactly. So you want to do that to warm up the glue, and it'll stay on longer, another day or two longer, just from doing this.
Yeah, I like using the back of that too.
Mm-hmm.
That's great
Yep,
friction.
do that. So now we're going to pull it, not 100%, but we're going to pull it about 50%. Lay it down. And then the remaining tip, the last 1.5 inches or so, I'm just going to brace my finger on the tape here after I did a 50% pull. And then I'm not going to pull the tip. I'm just going to lay that down. And then we're going to Okay, now this is where it can get a little tricky, because the SC joint is right in here. Now, sometimes if the clavicle comes forward, I have to put a little pad under here, but with her that's not the case. The other hard part about this area is it's often, the neck gets in the way. So when I put the tape on, it's uncomfortable to have tape on your neck. So we're going to have to make sure that we don't irritate the neck area. And then also in the summertime, people are wearing short sleeve shirts and stuff, and sundresses and things, so it's also going to show, and you just have to let the patient know that they're going to have tape showing across their chest or neck area.
Makes
Okay,
for
so
a good story.
yes, makes for a good story, exactly. So what we're going to do is we're going to cut this tape, because if we go with the long tape, it's just going to run up into her neck, and we don't want to do that. We want it to be comfortable. So remember what I said about the round edges? So we're going to go ahead and just make some round corners here. Doesn't have to be perfect. Do your best. Okay, same thing here. Crease it down the middle. So we just tear that tape right there. And then we open it up here. Just expose the middle. Expose the middle. Bring your arm back again. Yeah. And going to just... Now what I want you to do is look back and up and away that way. So we're going to cross right over the SC joint here. I'm going to lay this down here. Don't do what I just did. I didn't cut the corner on this one for some reason. I forgot to, or did I put the one that I cut down? I put the wrong one on. Obviously, you cut the corners, you're going to use that one on the skin, not the non-cut one. But at this point, we could take it off, but I'm not going to do that. Okay, and we're going to pull it again 50%. Come across your neck, and then the last part we're just going to lay down without pulling. Okay, now put your head to neutral there. Now turn your head. It shouldn't pull on your neck. It shouldn't hurt. Does that hurt? Does that pull on your neck?
I feel a little tension, but it doesn't
Okay,
hurt.
try this one. Do you feel it pulling in that way?
But
You do?
it's not painful now.
Okay.
It's comfortable.
So by doing that, by having them lift their head and turn this way and putting it on, you're going to prevent any discomfort of pulling on the skin on the neck when they turn their head, or if somebody has to drive, that can be uncomfortable. So you want to make sure you tilt the head back and have her turn it that way. And then we're just going to run the hand over here just to make sure the glue sticks good. Okay. And some cases I would put a third on with a pad and put that right over here just to press the clavicle down or back. We don't need to do that with you, but what I want you to do is go ahead and get changed real quick. Put your arm back in the dress, and we're gonna show everybody the range of motion you have with your shoulder. Okay, now go ahead, stand up, face the camera. You're gonna bend the elbow, and you're gonna raise one at a time. Okay, and then this one. How is that? Is it still limited, or?
No, it feels like it's supported and
Okay.
not as much like sharp pain.
Okay. We definitely need to work on her range of motion still. We're gonna work on the rotator cuffs in the back here, but that's something we certainly need to do with you. But you can see how taping the shoulder and unstable clavicle can be very helpful. Thanks for tubing in.